This week, Dr. Charles Vilfort will talk about oral hygiene. Your question could be, why he's not a dentist and he's going to talk about oral hygiene? One of the reasons why is because Dr. Vilfort considers all of us would like to live longer and in good health. Because of that, that came to my memory my great-grandmother from my father's side. I remember as a boy, she used to say, I prefer to stay hungry and take care of my teeth. At that time, I used to be laughing because I didn't know better. But with the experience I have today, I understand why she used to say that. She knew what she was talking about. And different studies worldwide, around the world, now are talking about the relation between bad oral hygiene and health problem. As I said before in one of my presentations, teeth and tongue are very important for mastication. And we have a lot of bacteria in our mouth. When we don't take care of our teeth, what is going to happen? We start having teeth decay, gingivitis, periodontitis, etc. But science or studies confirm when people have gingivitis, infection, or inflammation in their teeth or mouth, that can affect their heart, that can affect their memory, their reproductive organ, also their bones. And one of the example is Dr. Alexandre Boudleau was able to identify the bacteria Porphyromonas gingivalis, usually present in the teeth infection or periodontitis. And he said these bacteria usually can affect the good function of the teeth, because the protein, they can affect the protein in the mouth. And he said because of that, there is a relation between Alzheimer's disease and these bacteria defined in the brain. And that means people who have bad oral hygiene usually can have infection in their mouth, and that can also be a risk factor for Alzheimer's disease. But he's not the only one to say that. I don't know if you remember or if you've seen me before when I was talking about people who have 20 teeth or less had more possibility to suffer from Alzheimer's disease with age. And also, they realized studies on people over 65 years old or older, and they said most of them who has Alzheimer's, doesn't matter the stage, have had problem in their mouth. That means they have gingivitis, teeth decay, they have some kind of disease in their teeth. And we can think maybe there is no more. No, we have to continue. They also realize the problem we have sometimes in the teeth that can affect the heart and produce what we call blood clot. And this is one of the reasons they said bad oral hygiene has a lot to do with coronary disease or some heart issues. They also said some people with respiratory disease or chronic respiratory disease get worse when they have tooth or teeth problem. And regarding fertility, studies have confirmed people who cannot conceive, sometimes it's because of bad oral hygiene, maybe infection, maybe teeth decay, maybe gingivitis, etc. And they also have experiment on men who have infertility problem. They said as soon as they took care of their teeth, they have better sperm qualities and they were able to have better erection, and the infertility most of the time has been solved. Can you imagine that? I remember in one of my presentations at some place, I was talking to people and telling them sometimes women can give birth prematurely, cannot give a birth before their due date. That could be because of teeth problem. And they told me, Dr. Vilfort, I don't understand that. How come teeth problem have to do with early birth? I told them, it's only one body. And remember, when we are eating, we need teeth and tongue to have proper mastication. And when we are missing teeth or we have bad oral hygiene, we have infection in our teeth, that is going to the blood circulation, and that can affect the pregnancy. And when that affects the pregnancy, that could be one of the reasons for preterm babies. And also, sometimes during the pregnancy, women can have diabetes, and they realize diabetes during pregnancy could be due to bad oral hygiene. Can you imagine that? But they also find out some people can have pneumonia, and that could be related to bad oral hygiene. But you think we are going to stay there? No, we are going to continue. And when my great grandmother was saying that, we used to be laughing. But she was correct, because some of the problem bad oral hygiene can cause are diabetes, chronic heart problem, kidney failure. Oh, maybe you are saying, how come kidney failure has something to do with bad oral hygiene? It's because when you have inflammation or infection in your teeth or your mouth or around your teeth, that can decrease the strength of your immune system. And by doing that, that can affect your kidney. And this is one of the reasons why you can have kidney failure. But also, by decreasing the strength of your immune system, that can also be one of the causes of cancer. You see? And we can continue to tell you, when people have bad oral hygiene, that can also affect them psychologically. Their behavior could be different. I remember perfectly in my practice as a naturopath having cases of kids who parents were complaining about bad behavior and bad school performances. And I suggest them to start taking care of their teeth, and I even help them with some toothpaste. And guess what? In their next visit, usually they were able to tell me everything has been much better than before. Maybe you are saying, how come bad oral hygiene have to do with school learning? Yes. One more time, we have only one body. Whatever affects your teeth can affect the rest of the body. And also, it is important to say, when people have bad teeth or missing teeth, they can have digestive problem. I don't know if you remember that when I was talking about the pH. When you have infection in your mouth, that is going to affect your digestion first in your stomach and in the following step of the digestion process. Because when we eat, we digest, that is going to produce energy to our body to be able to function. And this is somehow to let you know, please, if you want to stay out as much as possible of disorders, take care of your teeth. Try to have, as much as possible, a good oral hygiene. But the last thing I'm going to mention about health problem and also stress. Stress can affect your health, can affect your teeth, and can affect your health in general. That means, me personally, for about 9 years, I've been using a toothpaste plus some supplement, and most of the time when I go to the dentist, they tell me, Mr. Vilfort, keep the good work. And if you want to receive the same compliment when you go to the dentist, you can contact Dr. Vilfort at 516-830-7371. But it's one of the reasons why I am talking about oral hygiene. Is because is not only dentists who can help you with your oral hygiene. In natural medicine, we can do that also. But you still have to continue to go to your yearly dentist visit and take care of your teeth. But we can assist you of taking good care of your teeth. For today, we are going to finish by asking you a favor. One of the reasons why Dr. Vilfort is able to talk about oral hygiene is because of your motivation. But how come you motivate me? You motivate me by subscribing to my YouTube channel. You motivate me by your comments, and you also motivate me by your visit or your phone call. Because without you, there is no need for Dr. Vilfort to be talking about health or about oral hygiene or whatever subject I want to talk or to present regarding health. See you next time.